Really like to thank Baby Chakra and Flipkart for this providing me this opportunity to discuss this interesting topic with you. And in OPD, we see parents coming with very common queries, and about it, they get really anxious. So, at the end of this session, I hope that I have clarified your doubts regarding the day to day handling of the baby, which are very important to the first time parents, particularly, and everyone in general. So, when a baby is born, uh, it's a very joyous moment for the family, and along with it, it becomes very overwhelming. So, what happens is the questions arise about the bathing, the feeding, the room temperature, the clothing. So, these are day to day questions, but they become very important to the new mother as well as to the family. So, I hope that this opportunity by Baby Chakra and Flipkart will solve your parenting doubts, and you will be more confident in taking care of the newborn baby. So let's start with the questions which are there. So first is that how do we handle the baby when we just received the newborn baby? So first questions that arise, they are regarding the breastfeeding, the massage, the clothing, the products that you would use on the baby. So for breastfeeding, first of all, the most important thing for the feeding of the kid, the mother should be motivated and educated for it since the beginning. That is during the antenatal period, during the pregnancy. If you will leave it towards the end, then it becomes very overwhelming for the mother to cope up with all the stress at that time. And this may have a detrimental effect on the feeding. So it is better that you go through the content regarding this, and there are various ways you can keep yourself informed about it. And also visit your gynecologist, get yourself examined, so that any issue like a very basic retracted nipple, that can also cause an issue later on during the feeding of the kid. So this is an issue which can be easily solved, and if you are informed, then you know how to handle it. So, first feed which is given that comes is the colostrum. It is very rich in energy, high on carbohydrate, fat, and protein. And this is has got all these things in the right amount to cater to the need of the newborn. So this should be always provided. It might be very small quantity, maybe even up to like 4 5 drops. It's yellowish sticky liquid, but this should be always given because it has got the protective antibodies for the baby, which are really important. So this should be provided, and later on the milk will start coming by around 4 to 5 days. If it is a second time mother, then it can come at an earlier interval also. And the most important thing is that even if the milk has not started to come, the baby should be put on the breast so that the let down reflex happens. So when the baby sucks on the mother, it produces a letdown reflex, that is the milk production starts, and this helps in producing more and more milk. And also the nutrition and the fluid intake of the mother should be good, so that the milk production can start at an earlier and it can earlier instant, and it can be then maintained throughout the period that is required. So this is regarding the feeding. If the breast milk is not coming, then there are formulas that can be resorted upon to if they want to continue that. And if the feeding starts coming later, they can shift to that, or they can go on a mixed feeding. For this, you can take a consultation and a call with your doctor and decide what you want to do. So this is regarding the feeding part of it. Now regarding the stump care. So the umbilical cord is clipped with either a thread or a plastic clipper, and the baby is handed over to the parents. Nothing is to be applied on the umbilical stump. So in a lot of cultural practices, they apply certain homemade remedies to make it dry. It would dry by itself even if you don't apply anything in around 4 to 5 days time, and maximum by 7 days it falls off. And sometimes it may fall off up to 14 days, but beyond that, if it is not falling, then you need to consult a doctor. So when it falls, it might cause a little bit of bleeding or 1 or 2 drops of blood, but it stops automatically by itself. You don't have to stop it or apply anything. If in case sometimes required, your doctor might provide you a dusting powder to keep the area dry. Always, when you are making the child wear any langot or any diapers, the cord stump, when the clip is still attached, it should be outside the diaper or whatever pads you are making the kid wear, because then it decreases the chances of infection. The infection generally manifests, if it happens, as redness in the area surrounding the stump, or there might be some discharge, or there might be bleeding, and the child might also appear to be less active, might have fever. So these are the common issues with the stump. Some individuals, they also have a practice of giving some karha or gutti to the newborn babies when they are born. It is not advisable to give these because first of all, it increases the chances of infection in the newborn, and also it might cause indigestion issues in the baby. So it is not recommended to give any of these pre-lacteal feeds, as they are called, to the newborn child. Then the other thing is regarding the products that you would use. So all the products which are not actually cosmetics, which are very mild and soothing for the baby's skin, they can be used. There are different brands available as per your region, and what is locally available to you, you can use that. The massage should be generally started after around 3 to 4 weeks, because before that the neck control is not much there, and also there are weight fluctuations in the baby. So we recommend not to start the massage at that time. Also, the bath of the baby, so we feel that the bath of the baby should be started. It can be either a sponge bath or a dip bath. When the cord has fallen off, then maybe you can start with the dip bath if you are confident enough to give that. The bath should always be given in a room where the ambient temperature is normal. It should not be a very breezy or a cold room. This is regarding the initial phase of the newborn care. And as per the children grow and the immunization and everything, then we take it point wise. Then the other question is, do I need to feed my child immediately the baby is born? So as the baby is born in a normal delivery or by cesarean. So if the baby is born by normal delivery, as soon as the baby is handed over to the mother, they can feed the child. There is no issue in that. However, in a cesarean section, the mother is under the effect of medication. So it might take up to 2 to 4 hours when you can actually feed the child on the breast. In some places, they might bring the child and they might try that. That is also completely okay if the mother is comfortable to do that. But in any case, the mother should not take a lot of anxiousness or tension for not being able to feed the child in the initial period, because as I said, the breast milk would take 3 to 4 days to come. So that, if that apprehensiveness comes, it produces lesser milk. So there is no point in getting apprehensive at that point. And this is regarding the timing of the breastfeeding. There is a, so normal delivery and cesarean, it is the only point that is deciding when you are actually feeding the kid. The condition of the mother can also express it in cesarean. If somebody is there, they can express and they can feed it to the child. The other question is, can I start using diapers for my newborn? That's a totally personal choice. Yes, you can use diapers also for the newborn baby as well. There is no harm in it. But the only thing is that when the diapers are being used for a longer period, you should pay attention to the frequent changing. You don't want the soiled diapers to be in contact with the baby's skin, because the ammonia and the urine, it will cause irritation of the skin and it will produce a diaper rash. So if they are being used regularly, you will want to give some diaper free time to the child, so that the baby is left for air dry, and also just wash the area with plain water, so that the contact of the urine and stool with the skin is minimized. Also, if they are being used for a longer period, then you can use any mild diaper rash cream, and apply it just on the perineal area. so as to decrease the contact of the stool with the perineal area and prevent the diaper rash. Even coconut oil can be used for this, applied in very small quantities, and later on, whenever urine or stool is passed, just washed with plain water is good enough. Okay, so the next question is, what care should I take for my newborn during these summers? So during the summers, the first question and the most common question is to give water to the newborn. As your pediatrician, everybody tells you that till 6 months of age, no other liquid is to be given apart from the milk. Either you can use formula or breast milk. If whatever it is, breast milk has got more than 80% of water in it. So if the baby is adequately fed, then there is no requirement of providing water to the till 6 months of age. So how would you know that the baby is adequately fed? By this is most commonly done by monitoring the urine output. So, if the child is passing urine for 6 to 8 times a day, then it is sufficient. If it is lesser than this, if it is a very dark yellow and a concentrated urine in a small quantity, then yes, it means that you have to look into the feeding part of the baby. So this is regarding the water intake. Now, regarding the massage with an oil. So coconut oil is generally the best to be used in summer months. You can use any oil, sesame, or you can use olive oil, but mustard oil is generally avoided the best because it depends upon how it is prepared. It is generally pungent for the baby's delicate skin, and it might produce rashes. And any massage should be always followed by a bath, particularly in the summer months, because it would clog the pores and produce a rash on the baby. Now, regarding the clothing can be a loose cotton clothes. They are the best in Indian summers, and the baby should not be very tightly wrapped, as in some cases. And the ambient temperature of the room, it should be such that the adult who is there with the kid, he is not feeling uncomfortable. If you are feeling uncomfortable in the room, like you are feeling hot, obviously the baby is also feeling hot. So the best way to check that out is with the back of your hand. You check the baby's touch the baby's palms and the soles, and check the baby's tummy. If all of them are at the same temperature, it means that the baby is comfortable. However, if the tummy is warm and the palms and the soles are cold, it means that the baby is feeling cold. So, depending upon this, by this meshed method, you can see whether your AC temperature or your cooler is producing the right amount of ambience for the kid or not. If you are using an AC, then 25 or more than that is a good temperature to maintain. And apart from it, if other methods like cooler or fan is there, the baby should be kept like this, that there is no direct afterfare on the baby. That is the thing that is to be paid attention to. This is regarding the care in the summers. And I feel like again, if you are putting the baby in the diapers, then you have to keep on changing it again and again. Otherwise, apply the diaper rash cream. When I need to check the weight of my baby once he is delivered. So when the baby is initially born, the baby's weight would decrease, because this is because of the water retention during the delivery time. So there is that weight is lost over a period of around 5 to 7 days, and after that the baby first regains the birth weight, and from there it's an uphill course. So generally after you are discharged, so normal delivery would be discharged at around third day, or a cesarean would be discharged on the fourth or the fifth day. So the baby is called at 7 to 10 days of life by the pediatrician. And at that time, we would check the weight again, because we expect the weight to start increasing again by that time. And if we find the weight gain to be appropriate, then we would call you directly at 6 weeks. That is the time of your first immunization. Otherwise, you might be called at an earlier interval. That is totally a call as per the examination, and that would be either again at a week's interval, or it could be again at 15 days. If everything is okay, you would be called at 6 weeks then, and then it is a monthly checkup. And also on discharge, you would be provided by the hospital or your pediatrician by with a weight record, that's your weight and height or a growth chart. And with that, the doctor will monitor your weight gain, whether it is appropriate or it is not. For low birth weight babies and prematures, it is always given. You can request that by your local pediatrician to give it to you. So the next question is, my baby breathes noisily when he sleeps. Is that okay? So regarding this, this is a very common issue faced by a lot of parents. So I would just explain it as if, like, think there are two pipes. So one has a smaller diameter and one has a bigger one. So when the air will flow with a lot of force, then in the smaller pipe it would produce more sound. So because the baby's nasal passage, it is narrow, that produces the noise, and if there is even a minor blockage, it will produce a lot of sound. So for this, you would be provided by saline nasal drops, which come in a variety of brands, and they are safe to use, and it's not actually any medicine inside it, it's just plain water. So that can be used up to 4 to 6 times by a day, only after taking consultation by your doctor. And if this sound is not associated with fever, with running nose, with cough, it is not affecting feeding or sleep, then it can be managed by simple saline drops. However, if any of these symptoms are present, then yes, then you have to um, consult the doctor and see why it is happening or why it is persisting. But generally, it is because even a minor blockage can produce a sound. So uh, it is evident and it causes a lot of distress. So our next question: my baby vomits a lot and does lose stools. Is it normal? So so regarding the vomit, first of all, so the vomit can be, it can be a curdled milk or it can be simply the milk as it is. If it is coming out as a curdled milk, then, and it's a small quantity, then you really don't have to worry on it. If it is a persistent or a frequent thing and it is happening in large quantities, if the milk is coming out as it is associated with other symptoms like fever, loose stools, or dull activity, poor feeding, then yes, it has to be paid attention to, and your doctor will give you some anti-vomiting medicines. There are some measures that you can do to avoid if there are small quantities of vomit is coming out, which are basically always burp the child. Try to burp the child after every feed. If you are doing that, then the probability of vomiting decreases. Then, when you're making the child sleep after taking the feed, you can put a pillow to so as to elevate the head end of the bed. So the pillow should be a very thin pillow, a 1.5 to 2 centimeter elevation pillow, and it should be placed such that this part of the body is elevated. So it's a common practice to just put it behind the neck. You should put the baby like this, that some amount of the shoulder, that is a bit of the shoulder, is also placed on the pillow. So that is caused as head end elevation. Then, along with it, when this is done, you cannot give a lot of medication to the newborn baby. So, it is better to do all this, and if it helps, it helps. Otherwise, then yes, your doctor would advise the medicines. Now, the stool part of it. So, when a baby will be born, he will pass loose stools, or the color of the stool is basically black. It is meconium. So it cannot be compared to the normal stool. It will take some time and then it will become into a golden yellow stool. The babies can pass stool up to 10 times a day, even up to 12 times a day. After every feed, they would pass the stool. It's a small quantity, golden yellow stool. It is normal. If it becomes in large quantity, if there is a drastic change in the number of the stool from one day to another, or the consistency and the color is very different from what the baby used to pass, then yes, you should bring it to the attention of the doctor. Otherwise, passing small quantities of this, particularly after the feed, in goldenish, yellowish, brownish color is considered as normal. If vomiting, loose stool, fever, all these things are associated, then yes, this points towards some sort of digestive issues or an infection, which has to be again brought to the attention of the doctor. So I think that was our last question. So I feel we have touched, it was a very interesting set of questions that people have asked, and we have touched upon the most important points and the questions that arise in the parents' mind. And my takeaway message to everyone would be that take care of the mother and child diet, take care of the mother as well as of the child, and the mothers to be confident and to be educated about what to expect and what to and how to handle the situation when it arises, so that at that time they are not overwhelmed and they can easily manage it. And a lot of the content is available on Baby Chakra, where you can read how people are dealing with these day-to-day situations. There are doctors as well as the mothers who have posted all the content, and you can go through it, and it will help to boost your confidence up. So I feel this, if people are prepared, then they become more confident in handling any situation. So I hope my session was helpful to you. And I again thank Flipkart and Baby Chakra for giving me this opportunity to connect with everyone. You can find Baby Chakra products on Flipkart, and please go through them. They are very good products. Thank you. And I hope the session was helpful to you.